The mobile response team responds to members of the community that are having family-defined crises where nobody is in danger, but the family feels that they are in crisis.
Families are calling when they need us, and that we go and we meet the families where they're at rather than them waiting on a wait list. It feels really good to be able to immediately go and start supporting that family.
Mobile Response is a brand new program. It doesn't exist anywhere else in the state. It doesn't even really exist that many other places in the country. And it is such a unique way to help families in the community by showing up for them rather than them forcing them to sort of show up to us.
I do feel like this program is fulfilling a need, a huge need, in that we haven't, in this area that I know of, ever had a mobile response before, a mobile mental health response. People call us and then we go. And it's great to meet people where they're at. You know, maybe transportation's a huge issue. Maybe they really don't have like internet access, or, you know, there's some barriers that I think that mobile response is really able to break through and get to families and meet them really where they're at.
We can connect them to resources or de-escalate the situation in the moment, and then we'll set future appointments with them to work with them over the next few months to try to get them generally stabilized while also connecting them to longer-term resources.
The timing of this is really important too, because so many kids have been struggling so hard during the pandemic. It's a very young kind of trauma almost to go through. I think that we've all been impacted so much, and I think that for kids this is something that they're going to be kind of processing for you know, the rest of their lives that they've been through. And so it's important to roll out those mental health services and start, you know, helping those kids through that right now.
Hospitals mostly screen for imminent danger, and getting an appointment with a therapist is sort of on the other side. That can take months. And so having this middle ground where we can respond very quickly within 45 minutes of the phone call, and there's a therapist, there's a case manager, we can offer those things just in this really comprehensive way, really quickly.
And I think that a big piece of what we do is preventative work with families, and supporting them in recognizing signs that maybe a crisis of some form is kind of developing, and identifying what that looks like for their kids or for their caregivers or within the family as a whole, and helping them develop the skills to navigate that and to hopefully prevent a crisis from occurring in the family. I want people to know that the kids that are receiving our services, that, you know, mental health doesn't discriminate, and that all kids are affected by mental health, and especially now, everything's, you know, really hard for everyone. It doesn't matter how much money you have right now. It doesn't matter where you live, and it's important for everyone to know that even very young children can experience, you know, mental health difficulties and mental health challenges, and that there's a way to meet those needs.
I love the team that I work with, and I value so much what the program is attempting to do, what we are doing. We're new, but we're doing it, which is actively serving the community by going and meeting. You talk about meeting the needs of the client or meeting the client wherever they are, but when you do that with case management or therapy, it's often, well, we're not really meeting you where you are because we're making you drag your entire family into the office to have a 15-minute conversation with us. This totally turns that on its head, and it says, we can come to you and listen to your problems and see if we can be of assistance. It's a totally different approach to mental health and serving the needs of a community. And you don't really see that other places. And I think it's really how, as a mental health agency, it's how we should be serving, or any sort of nonprofit that serves the community, that this is how we should be doing it. And it's really cool that it started in Rutland.